Hi everyone, I'm Nina. Welcome to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about reasons why your sleeve surgery might have failed. Before we start, I wanted to identify what somebody might label as failed. Let's say that you needed to lose 150 pounds and you've only lost 30. That you might consider that a failure. Then we have patients that have the colleagues that have needed to lose 150 pounds. They lost 150 pounds, but they have regained all the weight. So that is also considered a failure, a failed surgery. Another scenario might be that, again, you need to lose 150 pounds and you've lost 100 pounds. Personally, I wouldn't consider that a failure, but somebody that wants to lose 150 pounds and needs to lose 150 pounds, if your expectations are here and the surgery brings you here, you might consider that the surgery has failed. So what caused it? What happened? There are several reasons why you might have a failed surgery with the sleeve. First, and this doesn't mean that this is the most important, but it is the construction of the sleeve. You might not have gotten a very good sleeve to start with. The surgery is not the only solution for your weight loss problem, but it is, if you're getting weight loss surgery, you need a tool that will help you lose the weight and keep it off. So having a good sleeve done by your surgeon is the first step. We find that many sleeves are not done in the correct manner that give patients an efficient tool. Sometimes we find sleeves that are very big. You can see almost the whole stomach there, so a small percentage is removed. That is not enough to make it effective. Then sometimes we find sleeves that have a very large fundus, and that again holds a lot of food, and they start stapling on the lower part. Thirdly, we find sleeves that have a very large antrum, which is the lower part, and sometimes we find sleeves that have both, so it's like they're all full of bulges all over, and that holds a lot of food. What happens is that those sleeves can hold 3-4 times the amount of food that a tighter sleeve might hold, which is, makes it more efficient. Certainly you can still lose some weight, but if you're having a sleeve, the better the construction of the sleeve, the better your chances of long-term success. And that is what you want, definitely. So there are things that you can do to correct this. If the problem is of construction, it can be fixed through surgery. But we'll discuss that later. Another reason why your sleeve might have failed is that you didn't change your eating habits. All surgeries are just tools to help you change your eating habits. All of them, the DS, the bypass, the sleeve, the lap band, they're all focused on helping you change your eating habits. So the better the tool you have, the easier it'll be to change those habits and to help you lose the weight. There's no way around it. You need to get information from your doctor on how much protein you need to be eating, how much carbs, sugar, water daily. Get guidelines. Everybody that has had surgery should get information on how to work with the surgery. It's a new tool, you need instructions, and you should get that from your doctor's office. Now, another reason why you might be failing with your surgery is exercise. There are some patients that don't need to exercise to lose weight and keep it off. That's the minority. Everybody else needs to exercise. And again, it's not that if you don't exercise necessarily you won't succeed. It's that you have another strong element in your favor to help you lose the weight and keep it off. So it doesn't have to be 3 hours at the gym daily. It doesn't even have to be 1 hour at the gym daily. According to what you can do, it might be 3 times a week, an hour 2 times a week, or walking half an hour daily. Try and increase that and make it part of your lifestyle. Again, it's changing habits, not only in eating, but also in exercise that you do. Another very interesting situation that we are finding for some patients is that sometimes we get patients that call us and they have a very tight sleeve, years out of surgery. They are eating very small amounts. They're not eating too badly. I mean, they're following the guidelines. They're doing some exercise and they're stuck. Usually these patients are in the scenario that I mentioned, that you need to lose 150 pounds, you lose 100, and then you're stuck. It's like if your sleep will not take you any farther. That's where you are. And somebody that has been successful with their sleep and has lost the weight may say, well, you're not doing things correctly, you need to do this, you need to do that. And we shouldn't, jump to any conclusions. There are some patients that need the metabolic effect, the malabsorption part that maybe a DS and a gastric bypass can offer them. It's just that these patients need additional help. So there's also a solution for these patients, but it might be that situation that you need an extra help. These patients, sometimes we have a lady that said, okay, I'm even going to do a period of liquid diet. I am going to really focus in the next 2 months in trying to lose that weight. And she followed this strictly, and not even a pound. She didn't lose any weight. So, she said, okay, I'm ready to get something else. And lastly, another thing that's very important is support. And support, I've broken it down in 2 parts. Support from the community, support from friends, support from peers is very important. It keeps you accountable. It helps you keep on track. You're talking with patients that have been through similar things. Maybe they're ahead of you and can already offer you tips on maintenance, for example, or they're just starting and you can offer tips on, how to jumpstart their weight loss or get out of plateau, things like that. It's really, really helpful. And another kind of support is the support from your doctor's office. It's very important that you're able to have that communication, and so they can offer you solutions depending on where you are. If it's initially after surgery, or if maybe you call them 3-4 years later and say, I'm having these issues, what can I do? Can you guide me in the right direction? So that is also something very important. We get calls from patients that live close by that they had surgery and nobody's taking care of them. Sometimes they don't even have proper instructions on what they should be eating, and they're really kind of lost. And that's very important. Be sure that you have that communication with your doctor's office, and that if you need anything, they're there to help you. Now, if you're in any of these scenarios, it doesn't mean that not having one of them will necessarily mean that you will fail. It just means that when you have all these 5 aspects really solid, it's like a table with 5 legs. If they're really solid, you will be successful. If one of them is missing, it will be a little bit harder. Let's say that your sleeve wasn't properly constructed. You'll have to rely more on your habits, on your exercise, on the support to compensate for that, and it's a little bit harder for you, but you still can do it, definitely. And the same thing if you don't exercise. It's when you have everything in place, your chances of long-term success are higher. So this is what we recommend, that you try and focus in all aspects to have good results for the rest of your life. In another video, we can discuss the options that you have if you are in any of these situations with a failed gastric sleeve surgery. If you have any questions, if you have any x-rays, a lot of patients send us x-rays. There's no cost. Our doctors are happy to review them and give you their opinion on whether, it seems like you have a sleeve that is effective, that is really helping you through your process. Or if you have any questions and want to comment, feel free to do so. I hope this helps. I hope to see you soon. Bye-bye.